If you suspect a person is suicidal or a harm to themselves or possibly a harm to others, then you can sort of break any confidences, and that will need to be dealt with.
Do you cover that on the mental health first aid course?
Yeah.
How you would recognise
look, there are things to look for. One of the biggest myths attached to the suicide risk is that the myth is that people who talk about suicide are not going to do it. That's just incorrect. And it's looking for pointers. It's looking for behaviour. It's looking for people who are possibly getting things in order, sort of saying goodbye to people, behavioural differences, planning it, having the means. But then you are duty bound to sort of report that if you suspect it.
I've got an observation on that topic, and you know me well, Malcolm. I'm in danger of using the bollocks word on this one, because someone has sent in here. It's anonymous, but it's about reporting distress, and they said that they were in a situation, I believe in clinic, with a 20-year-old girl who was self-harming, and he or she was concerned about this girl. He contacted our trade organisation, for want of a better word, the Institute of Osteopathy, to ask what he could do in terms of reporting it, and was told that without her consent he couldn't report the situation to anyone. Kerry, I think it is, who's talking about a case that was mentioned earlier, the 20-year-old who she had concerns about. She had her mother's contact details, but the patient had specifically told her not to contact her parents, and that puts us in a very difficult position, because on the one hand we cannot breach the confidentiality unless we think there is a serious threat to the patient's well-being, and the osteopathic practice standards and the chiropractic code don't specify it has to be a threat of suicide. It says health of the patient, well-being of the patient, or worse to that effect.
So I would have, I deliberately changed my GP when I was 18 because I did not want my GP talking to my parents about my mental health.
Right.
In that circumstance, in these days, the conversation I would be having after that very explicit and clear statement is, okay, who should I contact then? And I think that is a good opportunity to say, well, it's important for me as your practitioner to have an emergency contact. I get what you're saying. That's not the right person. Can you give me someone who is? And that would, because you still need that. You still have that duty of care. Someone who's 20
It doesn't have to be a family member, does it?
No, it absolutely doesn't. Someone who is 20, clearly, their parent has no right.
No,
and Kerry has said that, I'm reading on subsequent questions and observations. She says that further to that, the 20-year-old did eventually give her consent to talk to the GP about the problem. But it must have been a lengthy or involved conversation to get that. Someone who hasn't given their name asks whether we're qualified to decide whether somebody is suicidable.
You can ask them. It's perfectly acceptable to ask.
I genuinely wouldn't have thought of that.
Yes, you can. Again, it's another one of these myths that by asking someone, people worry about asking someone if they're thinking of taking their own life because they feel it's implanting the thought in there that wasn't there, which is not true.
Exactly. You nearly said bollocks then, didn't you?
I nearly did, yes. Very close.
The opposite is true. Asking that question, the evidence is that makes suicide less likely, not more likely. So the perception is asking the question.
It's going back to the point I made earlier about people worrying about saying the wrong thing.
Yeah.
But it's perfectly acceptable if you believe someone is thinking of taking their own life to actually ask the question.
Right. And the other observation on that, if I may just say this one, is could we clarify the advice to what to do if we think there's a high risk if a patient is suicidal with or without consent? And I think we all agree that if you think someone's suicidal, you alert at least the
call
GP.
999 if you think it's imminent.
Yeah.
Really?
Yeah, absolutely.
Who would you ask for? You told us that paramedics are not equipped to deal with mental health problems. Are we calling the police to help restrain them? Or?
I would call for both,
yeah.
personally, because paramedics haven't got the power of restraint, whereas police have. And then that will depend on what would occur at that point. But they will need to be taken to hospital, of course, and that's the paramedic's job.
So if it's an urgent risk of suicide, an imminent risk of suicide, 999
you would call an emergency the same as you would for a heart attack.
If you think it's just maybe a little bit less urgent, the GP would be the appropriate.
Yeah, but there are some constructive things that anyone can do if they find themselves in that situation. Asking the question and talking about it is one that is counterintuitive, but is certainly the case that is beneficial. Anything that gets people to think for the future. So yeah, booking another appointment in 2 weeks' time, signposting people to something that might help, discussing what it is that might be making people feel like that. Those are the kind of things that are genuinely helpful. So you know, if it's a debt issue, signposting someone to something that will help you with debt. If it's a relationship issue, signposting towards people who will help with relationship counselling. Those are the kind of constructive things that you know. Again, it's not your job as an osteopath to do that, but you know, it's always useful to have in your back pocket places where you can refer on, like you might have with Bipolar UK. You know, you mentioned the work that I've been doing with Public Health England, the Every Mind Matters campaign. There's a lot of resources.
Do you think if someone's suicidal, it might be better to approach them on a personal level rather than raising their stress levels by calling 999 or another
Personal level
authority?
first.
Yeah.
I would suggest assume that, well, the first thing to do is to make sure that you're safe. That's always the first thing. As in physical first aid, your safety is, the person's safety is paramount.
Is that likely to be a problem with a suicidal patient?
It's not necessarily likely to be a problem, but obviously you just need to ensure, yeah. So your safety is first. So assuming you think it's safe to approach them, then yes, by all means, a personal approach. I wouldn't necessarily immediately call 999. I'd try and talk to them first.
I suppose the dilemma we have is that we need to be very sure that they are safe when they leave us, because otherwise we haven't executed our duty to keep them from harm. If we approach them on a personal
that's
level,
a very difficult thing because you can't. I mean, you don't know what they're thinking.
Yeah.
So I think if the doubt is still there, then you are within rights to.
And it might not be 999. It might be the GP. Perhaps. And
This is why I think the emergency contact is a really good thing to have as part of your conversation in any case, because that would be a if you're genuinely really concerned about that person walking out of your surgery, having that, and you think that's an emergency, you have an emergency contact. That's a really perfectly reasonable thing to do, and that is one way of discharging your duty of care, is to say, okay, I think this is an emergency, I have an emergency contact, I've made contact with this person, I've expressed my concerns, they probably know the person way, way better than I do, they will have a better sense of perspective, they'll have a better sense of whether that presentation is, and if supposing someone is bipolar, and that is a particular pattern, it may be very familiar to their emergency contact, who will probably say, well, thank you very much for letting me know. Don't worry about it. I'm going to meet them. I'm going to see them in 20 minutes. But thank you very much for alerting me. And the chances are, if it were me leaving that and it was my chiropractor making that call, I'd be delighted that they'd cared that much to do it.